This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
Soft cataracts, especially the crumbly ones, can be a tricky situation. We can either chop them or divide them. Let me take you through one such case and what are the strategies which one can employ to deal with in such a tricky situation. Now he is a 65-year-old gentleman. He has an anterior subcapsular cataract. The central 4mm appears to be slightly calcified, the anticapsule. The rhexis is done beyond that, so we have a nice 5mm rhexis. The rhexis is appropriately sized and I'm not expecting any difficulty in the nucleus management. However, once I do hydrodissection and I'm attempting to do a direct chop, in spite of using very low power, I'm unable to get a hold and you can see that the nucleus just crumbles and melts and I'm unable to get a hold to do the primary chop. This is a case where I did not anticipate the nucleus to be so soft and I wasn't expecting any difficulty. So the rhexis is appropriately sized but not the right size for such cataracts. For such cataracts, a slightly bigger rhexis would easily prolapse the nucleus out. Now we have a situation where the rhexis is not ideal for this, it's slightly smaller for this type of a cataract and we cannot prolapse the nucleus out. And we are unable to divide into smaller fragments by direct chop. In such a situation, what are the strategies which we can employ? So typically in this situation, I convert to stop and chop technique and I would like to bring each of the heminucleus out of the bag and then emulsify. Rather than dividing them into 6 pieces which we typically do, I'm going to just divide into 2 heminucleus and pull it out. And there is a small change in the technique as well which I'm going to highlight. Now I'm sculpting using very low power because as we know just a couple of sculpts can take us to the posterior plate here. So one change which I'm doing here is instead of a straight groove, I'm making a slight type of a Y groove in the terminal edges. As I reach the peripheral part of the groove, I'm widening the groove in the peripheral part by doing a left and a right sculpt and then rotating the nucleus and doing the same maneuver. The idea is I want to have a slightly wider trench in the peripheral part of the groove, not in the center. The reason is simple. When I do a lateral separation, I want to bring out one of the heminucleus out of the bag. If there is no space in between the heminuclei, it becomes really tough to pull them out because they are jam-packed attached with each other. So to create some space, especially in the peripheral part, I've just widened this groove. So this groove, I call it as the double Y groove. I rotate the heminucleus so that the groove is in the right position. Now there's another trick here. You cannot hold the heminucleus in the center or in the paracentral area and try to pull it out. It won't come. The trick is you need to hold the nucleus at the most peripheral part of the heminucleus, that is at the edge of the heminucleus. By doing so, the amount of nucleus which faces the resistance of the overlying rhexis is minimal. So we can flip that part out of the bag quite easily. So as we can see, I'm trying to hold the paracentral region and try to pull it out. It won't come. So what I'm doing, I'm going to the most peripheral part using a very small burst of phaco with low energy so that the tip goes and occludes the edge of the nucleus. Then I'm gradually pulling it out of the rhexis. So the amount of barrier effect the rhexis is going to have is very limited because we are holding the edge of the nucleus. Once the peripheral 1/3 of the nucleus is out, the rest of the nucleus can easily be maneuvered out of the bag and then emulsified. Same thing, the nucleus is rotated. Even for the second heminucleus also. Rather than holding the heminucleus centrally, I'm going to hold it at the peripheral edge, give a short burst of phaco, engage it and then pull it out of the bag. Then it's emulsified. Rest of the steps are similar. The cortex is aspirated. The lens is implanted using the hydroimplantation technique. The toric lens is aligned at the appropriate axis. That's it, the case is done. So just to summarize the small trick here. So if we are stuck in a situation where the rhexis is smaller for a softer cataract and we're unable to chop it, I quickly switch over to the stop and chop technique. The plan is to maneuver these 2 heminuclei out of the bag and then emulsify in toto. The problem which we typically face is maneuvering one heminucleus out of the bag. There are 2 resistances for this. One is the resistance by the adjacent heminuclei, because they're very compactly attached with each other, just like a jigsaw puzzle. The second resistance is the overlying rhexis itself. To counter this, we have got two tricks here. One, to widen the groove in the peripheral part so that the peripheral part of the two heminuclei are not compactly arranged. Number two would be to engage the nucleus at the edge, not in the central or the paracentral area. The reason is simple. When we pull the nucleus from its edge, the amount of resistance it faces from the overlying rhexis is very minimal, so it comes out quite easily. Once 1/3 of the nucleus is out, the rest of the nucleus follows quite effortlessly. So that's the trick here. Same with the second heminucleus. If we hold the nucleus at the center and then try to maneuver it out, the amount of nucleus which has to face the overlying barrier of the rhexis is quite large. Instead, hold it here. The amount of nucleus which has to face the overlying barrier of the rhexis is very small, so it can easily be maneuvered out, and then once it is out of the bag, emulsifying it becomes very easy. So that was it. Thank you for watching and hope you found this helpful.